As director of the National School of Veterinary Services and France Vétérinaire International here in the campus of VetAgro Sup in Marcy-l'Étoile, I'm pleased to present you training and expertise that we carry out on the field of One Health. The National School of Veterinary Services provide training in veterinary public health field since 1973, and it's OIE Collaborating Center since 2004.
As a result of our research in sociology and economics, Christophe Després, Sébastien Gardon, and myself launched 2 years ago the One Health in Practice Diploma. The Diploma is the only training course in France aimed at human, animal, and ecosystem health professionals and based on concrete cases of governance and management of health issues. We have a rich pool of academics and experts with very different professional backgrounds and international partnerships. An international version of this course will soon be available.
Interdisciplinary training in the field of One Health must also concern all public decision makers, which is why the French government has decided to establish a core courses for the training of official servants within the framework of the creation of the National Institutes of Public Service. In this context, the UNSVPH has developed, together with the School of Human Health and other schools, a roundtable on the theme relationships with science in order to promote the use of scientific expertise in public decision-making and the link between risk assessment and risk management, to explain the difficulties of public decision-making in situations of uncertainty and, in particular, crisis management, to stress on the relationship with society and the interests of citizen consultations. And finally, to illustrate the difficult articulation between science, innovation, and society. Another theme related to the ecological transition also stresses the One Health environment component in order to raise awareness of the issue among all senior officials and not only the officials of the Ministry of Ecological Transition.
Cycle des hautes études en santé globale is a joint training proposal for civil service officials at the collective initiative of the School of Public Health, School of Engineers, Frauds, veterinary schools, and UNSV FVI. The challenge through this training is to provide a transversal and multidisciplinary vision, as well as a necessary rise in the field of global health on a territorial, national, and international scale. The objective is to improve the coordination of services in the prevention and management of risk, to initiate networks, to provide knowledge and skills in the field of environmental health by providing theoretical and practical tools.
Supported by the VetAgro Sup VPH Chaire, the UNSV FVI, the UCBL1 and private partners, the Master One Health, Managing Health of Populations, cover a broad range of One Health topics and call for interdisciplinary and intersectorial action in the management of public health problems. The Master is conceived as a 1-year course, 6 months training and 6 months internship. It includes as a common core curriculum and 2 specializations options in risk assessment and risk management. The course is targeted both at students in medicine, veterinary studies, economics, ecology, social science, and at working professionals such as officinal veterinarians, doctors, health managers, and economics. The career opportunity include all types of health professionals involved in risk assessments or risk management. The course is taught entirely in English and has a large network of actors, contributors, and partners.
In terms of One Health initiatives, the NSVVI collaborates with many countries. International Action Service offers since 2014 face-to-face or remote continuing trainings intended for an international audience of decision makers from the veterinary domain. The priority objective of our trainings is always to contribute to the implementation of the OIE standards.
The projects developed in the One Health field aim to meet 3 main objectives: interdisciplinarity, prevention and risk management, the practical application of the One Health concept through concrete example and work, which is for me a priority.